Doctor, when you formulate a treatment plan for someone that uh, you look at and has memory issues, does the treatments vary depending on how far along the road that you determine that person is?
Absolutely. The earlier the patient is diagnosed, the more aggressive in a lot of ways that I am.
Mhm.
When someone is more moderate to severe dementia of the Alzheimer's type, a lot of these interventions just don't seem to work as well. Again, we don't have all the data and we don't have all the answers, but patients come to me because I'm known for a 20-step plan for Alzheimer's disease. I recently completed a book on Alzheimer's, treating Alzheimer's disease and preventing Alzheimer's disease. And in this book, we go through all of the multimodality approaches, these 20 steps. And really, if someone's diagnosed early enough, I will put them on almost every one of these 20 steps of the plan. If someone comes to me for a second or a third or fourth opinion on managing Alzheimer's disease, I may not be as enthused about 4, 5, or 6 of these interventions, because these interventions take several years to really help or work. So each patient really goes on a very specific plan. All patients go on a very specific diet. You are what you eat. If you can change the way you eat and follow a very specific diet, I put patients on a very specific diet plan over 9 weeks. They build up to a specific level, and then over time, have them maintain themselves on a very specific style of eating that incorporates antioxidant foods, low carbohydrates. It's a comprehensive plan. Almost all stages I actually put on the diet, because I think that's been shown in mice, in dogs. Dogs get Alzheimer's disease, canine cognitive function disorder. And if it's worked in dogs and if it's worked in mice, I'm going to use it in humans.
Can you talk a little bit more about that diet and what that consists of?
Sure.
And it's, I would imagine something that if we didn't have memory problems, it would still be beneficial.
Absolutely, and a lot of this data comes from animals. Canine cognitive function disorder is a problem where dogs get Alzheimer's disease. After 8 years or so of age, many dogs get Alzheimer's. They lose their keys, their cell phones. No, they don't do that. But the brain modeling, when you look at the pathology in the brain, they also get amyloid. So several studies have been done in dogs, looking at changing diet, and also changing diet in combination with exercise and socialization. Having dogs or humans eat low carbohydrate diet, low saturated fat in specific amounts and in a specific pattern that I recommend. In the data, and the paper came out just in December of 2010 in the Journal of the Neurobiology of Aging. Other researchers, Suzanne Kraft, Carl Kottman, have done a variety of research in humans and dogs to show that changing the diet can actually improve memory function in Alzheimer's patients and also delay progression from mild cognitive impairment to Alzheimer's disease just by changing the diet. And there's very specific things, not just antioxidants and not just eating healthy and low saturated fat, but it's more comprehensive. But there's a variety of things that we now know are proven with diet modification.